Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see some important expected questions for exam preparation. In the previous section of videos we discussed expected questions and its answers, that is video number 3. Here again we can see the next set of questions for the exam preparation. So study well for the exam. Here we can see question one by one. First question, preterm babies are prone to secondary athletasis because under options, option A, lung alveoli are not fully developed. Option B, amount of hemoglobin is less than normal. Option C, surfactant is deficient. And option D, diaphragm is underdeveloped. So here correct answer will come option C. Surfactant is deficient. So preterm babies means the babies who are born before 37 completed week of pregnancy. They are known as preterm babies. In preterm babies may develop athletasis, secondary athletasis. Athletasis means collapse of the lungs. It is due to the deficient surfactant. Okay, option C is the correct answer. And next question, preterm babies are more prone for developing hypothermia due to, and options, option A, large surface area, option B, deficient brown fat, option C, poor food intake, and option D, all of this. And correct answer will come all of this. Okay, preterm babies means babies born before 37 completed week of gestation. So these babies are deficient of brown fat and poor food intake and large surface area are the characteristics features of this preterm babies. So preterm babies will develop hypothermia. Hypothermia means body temperature will falls or goes below normal. Okay, that is hypothermia. So the preterm babies are more prone to hypothermic due to all the factors. So answer option D, all of this is the correct answer. Next question, during phototherapy the distance between the baby and the light source should be, and our options, option A 20 centimeter, option B 45 centimeter, option C 70 centimeter, and option D 100 centimeter. Here correct answer is option B 45 centimeters. So as we all know, phototherapy means is one of the treatment of pathological jaundice for newborn babies. Okay, so here in phototherapy what will occur? That is the phototherapy converts unconjugated bilirubin into more soluble form of bilirubin which can be easily excreted through urine. That is the mechanism of phototherapy. Here our question is the distance baby and the light source should be 45 centimeter. Option B is the correct answer. This is one of the important question. Next question. This question also important question. In phototherapy, which range of light is used? And options, option A 100 to 140 nanometer, option B 240 to 350 nanometer, and option C 420 to 490 nanometer, and option D 550 to 650 nanometer. Correct answer is option C 420 to 490 nanometer. The range of light is used, that is 420 to 490 nanometer. Next question, cystic duct is the duct of, and our options, option A liver, option B pancreas, option C gallbladder, and option D duodenum. So the correct answer is option C gallbladder is the correct answer. Cystic duct is the duct of gallbladder. In the picture we can see the cystic duct which connect gallbladder to hepatic duct. Okay, that is cystic duct. And the next question, in following which is the pale grey gland of the body? And our options, option A pancreas, option B gallbladder, option C liver, and option D stomach. This question today I kept in the voting poll. Most of them answered wrong, so that's why I kept in the video. So pale grey gland of the body is pancreas. So important question. Next question. Major muscle protein in the body is. And our options. Option A actin, option B myosin, option C troponin, and option D all of this. So major muscle protein is myosin. Option B is the correct answer. Myosin is the major muscle protein. It constitutes about 60% of all muscle protein. Okay, this muscle fibers are composed of proteins. They are called actin and myosin. Among this, myosin is the major muscle protein. Next question. Most common type of immunoglobulin is. And our options. Option A IgM, option B IgA, option C IgG, and option D IgE. Question is, which is the most common type of immunoglobulin? And our correct answer is option C. IgG is the most common immunoglobulin. Okay, immunoglobulins or antibodies are glycoproteins which are produced by plasma cells. There are 5 types of immunoglobulin: IgG, IgA, IgM, IgE, and IgD. Among this, IgG constitute about 70% of total immunoglobulin. Okay, so the most common immunoglobulin is IgG. Okay, option C is the correct answer. Immunoglobulins are important areas. Question can come from this area. And the next question, granular material present in cytoplasmic ribosome of neuron are called. And our options, option A Schwann cells, option B Nissl body, option C circle of Willis, and option D none of this. Here correct answer is Nissl's body is the granular material present in the cytoplasmic ribosome of neurons. Okay, Nissl's body. And first option Schwann cells. Schwann cells which forms myelin sheath of a peripheral nerve fibers. And circle of Willis means it's an arrangement of arteries to supply arterial blood to the brain. Here option B is the correct answer. Next question, epithelium which is lined by cervical canal is. And our options, option A ciliated columnar epithelium, option B simple columnar epithelium, option C stratified squamous epithelium, and option D transitional epithelium. So the epithelium which is lined by cervical canal, that is the question. So correct answer is option B simple columnar epithelium. Okay. So this epithelial tissue, various epithelium which is lining various organs, that also important area. So this question also important question. The next question, musician nerve is. Options are option A median nerve, option B ulnar nerve, option C sciatic nerve, and option D none of this. Here correct answer is option B ulnar nerve is known as musician's nerve. Option B. And the next question, Taylor's muscle is. Options are option A masseter muscle, option B sartorius muscle, option C serratus anterior muscle, and option D stapedius muscles. Here correct answer is option B sartorius is known as Taylor's muscles. Option B. This stapedius, option D stapedius is known as smallest muscle of the body, and option A masseter is there. This masseter is known as strongest muscles in the body, and serratus anterior is there, that is the boxer's muscles. Here our question is Taylor's muscles, that is sartorius. Option B is the correct answer. Next question, boxer's muscle is. And our options, option A masseter, option B sartorius, option C serratus anterior, option D stapedius. So boxer's muscle is option B serratus anterior is the boxer's muscle. Okay, and the next question, chewing muscle is. Okay, and options, option A masseter, option B sartorius, option C buccinator, and option D tongue. Okay, among this, we can guess option C. Buccinator is also known as chewing muscle. And the next question, this is the last question. Shortest, broadest and most curved rib is option A, first rib, option B, seventh rib, option C, 11th rib and option D, 12th rib. So question is shortest, broadest and most curved rib is. The correct answer is option A. First rib is the shortest, broadest and most curved rib. And number of true ribs is 7, that is first to 10th is true ribs, and the number of false ribs is 8th and 12th, floating ribs is 11th and 12th. Total 12 ribs are there. Here first rib, shortest, broadest and most curved rib.